Hi, Ben. Thanks for joining us today on Voices for a Healthy Future. You're a GP based in Newcastle, but you're also a passionate supporter of climate action. What's your key motivation behind this?
So I'm a GP seeing patients in a suburban practice doing all the usual things. So my passion is about using science, what we understand about health to make people's lives better and keep them well. And we do that sort of one by one in the clinic, but there's a chance to do it 1,000 at a time by influencing environmental and policy debates. So I think there's a real opportunity to try to help people look after themselves and make the environment better for playing well. And that's behind my environmental interests.
And you've been quite vocal in raising awareness of negative health outcomes of burning gas in residential homes, particularly the use of gas cooktops. Why is this such an important issue?
Yes, so look, respiratory illness is very common. We see a lot of people with asthma in our clinics, especially children, and it's a source of great distress for parents to see their little ones wheezing away. Asthma is triggered by all sorts of different things in the environment, viruses and dust mites. But one thing that no one's got much awareness of is the fact that the combustion products that come out of your standard gas stove are also a respiratory irritant. And for some children, that's what sets off their asthma and is also more likely to make them develop asthma in the first place. So when you burn gas in a stove, it releases nitrogen dioxide and some aldehyde, a few other little trace elements, but mostly the nitrogen dioxide accounts for the health effects. This showed up in research conducted over the last 10 or 20 years. It wasn't previously known about, but there's strong evidence from cohort studies that kids living in households where there is a gas stove are about 40% more likely to have asthma.
Right. Okay. So, we've been using these sorts of gas cooktops for many years. Why is it only now that these dangerous fumes are coming to our attention? Is there a reason behind that?
The science has only been done in the last couple of decades, and the alternatives have only become available. So, 50 years ago, a gas cooktop was the only way to do really good cooking, but now there's very nice induction cooktops which do a perfect job. And there's really no need to be burning gas indoors anymore. So, the kitchen cooktop, the induction does a much better job. For space heating, the reverse cycle air conditioners do a much better job. And so those two indoor uses of gas. And of course, mostly outdoors water heating, heat pumps are much more efficient. And also direct solar does an excellent job of making water. So there's no longer any domestic job that gas is the best solution.
Right. Okay. So it's a mixture of obviously the science that's developed and technologies that have become available. There still seems to be, despite this, quite a bit of opposition to switching from gas at the moment. What are the main obstacles that people are having with making the change here? And what would you like to say to encourage households to act more quickly on transitioning to an electric cooktop in their home?
Look, at a household level, getting rid of your gas stove, it's a bit of an investment. You have to buy a new stove, and also if it's an older house, you have to get sufficiently heavy-duty wiring installed for the kitchen, so that can be an extra cost making the transition. But if the gas stove was the last gas appliance in the house, when you get rid of that, then you stop paying gas bills, and that's a saving of about between $200 and $300 per year for the household, not paying a gas bill. And now, of course, you use a little bit more electricity, but the stoves are so efficient that it's only a small 3-cent electricity cost. So that's for people who are ready to make the change and fully get rid of their gas stove. A lot of people live in rental accommodation or aren't able to make that big change at the moment. But in those situations, you can reduce the respiratory problems by opening a window or turning on an extractor fan every time you light the stove.
Right. And I guess at times I've also heard a bit of, more ideological opposition to it. People saying, "Oh, well, the gas, cooking with gas is better," or that the chefs
cooking with
gas.
Cooking with gas was an advertising term invented in about the 1930s in the US.
Mm-hmm.
As wood stoves were replaced by either gas or electricity. There was competition between electricity companies and gas companies to capture the market. And cooking with gas was made up by a gas advertising executive and incorporated into a comedy show and became part of the kind of lingo So look, it was an advertising term from the start, and nowadays the gas industry is trying to defend its turf. They've been sponsoring MasterChef gas, putting advertising dollars into trying to deny that gas is harmful and trying to deny the fact that the reticulated gas system in the suburbs is probably going to be shut down over the next 10, 20 years.
Right.
So, yeah, I think in 20 years' time, even if you wanted to buy a gas stove, there won't be a pipe to plug it into.
Right. Yeah. Is there a danger that the gas companies are the new cigarette companies of the next?
The gas companies are defending their product and trying to keep selling it despite mounting evidence that it's not useful and it's harmful to health.
So what about communities that either that rent or are not in a position to easily upgrade a harmful gas stove? Is there more that we could be doing to help vulnerable Australians like that?
Look, I would like to see if there are public housing units that have gas stoves, to have those gas stoves removed, because that's within the power of the landlord, in this case the government, to be able to do that. But for people who have a gas stove and are not able to turn it off and get rid of it, like we're saying, improving ventilation, opening a window or a door, running an extractor fan, as long as it's vented to outside the building, all those things will reduce the health.
And what about in policy terms? Is there anything more that perhaps the government could be doing policy-wise to help people outside of, obviously, as you mentioned, the community housing?
I think there would be a big benefit from some public health education on this topic. Just getting the message out of simple things that you can do to protect children from combustion products that come out of stoves, and starting to think about the fact that you can still go to a shop, down at your local Good Guys, and buy a new gas stove. That stove will probably still be in operational condition after the gas networks have been shut down. Mm-hmm. So there's a bit of consumer education there that if you're buying a long life product expected to work for 30 years, it may end up a stranded asset.
Right, yeah. Or just the cost of having connected to the property, I guess, yeah. Even once no longer using the gas, you've still got like supply charges and so on, yeah?
Yeah, it's certainly all up and down my street, people are turning off their gas connections.
Yeah.
So from the point of view of the company that runs that gas pipe, they have to still do the maintenance from a decreasing customer base.
Yeah.
So eventually they'll find that it's not worth doing.
Yeah, that makes sense. Okay, and just our last question here today, Ben, what would you say to healthcare workers to encourage them to become more involved in climate-related health initiatives?
I think the question of combustion products from indoor gas appliances is a good one to bring up in any consultation that's about a child with asthma or an adult with asthma. When I started talking about this with patients, a lot of people were very receptive to that message. They hadn't heard about it and interested to know. A surprising number were saying, "Oh, well, we're planning a kitchen renovation next year." Change up. Yeah, so it's a good way to bring in the question of the indoor environment into a consultation, and it does line up with people's interest in reducing their carbon footprint and the environment.
Well, thanks so much for joining us today, Dr. Ben Ewald. Really, really appreciate your time, and we'll look forward to chatting with you again soon.
Thanks, Ari.